Okay, so we can move on to the next speaker. And let's see if I can. Share my screen here. Okay, let's see. Let's do that again. Okay, so I want to make sure that I'm sharing the right screen. Okay, so our next speaker is Mahar Mangahas. And Dr. Mangahas is a Filipino economist whose research spans rice economics, land reform, poverty, hunger, income inequality, quality of life, governance, and public opinion. He has been an economics professor at the University of the Philippines, a UNICEF social indicators consultant in Malaysia and Indonesia, and the vice president for research of the Development Academy of the Philippines. In 1985, he co-founded and has since headed the Social Weather Stations, a survey research institute that focuses on quality of life, opinion polling, and governance. Among his awards are the 2001 Helen Dinerman Award of the World Association for Public Opinion Research, the 2011 University of Chicago Alumni Award for Public Service, the 2014 Distinguished Research Fellow Award of the International Society for Quality of Life Studies, and the 2015 Distinguished Alumni Award of the University of the Philippines School of Economics. In 2018, Dr. Mangahas was selected as Academician of the National Academy of Science and Technology. And you may be able to read his weekly column, which is in the Philippine Daily Inquirer, and that is called Social Climate. And so with that, let me stop sharing. And so Dr. Mangahas can share his slides.
Good morning. So this is the title of my talk, Service in the Time of COVID. The SWS 2020 mobile phone surveys is a problem that we were not able to continue with our face-to-face surveys for the time being and had to go to mobile phone surveys. Next slide. It's a big problem. Face-to-face is time-tested mode of field work. But this has affected the sampling of the dwellings in the sample spots because we have the field workers have to go there and look for dwellings at random. And secondly, interviewing of the designated respondent in the dwelling. These things are directly affected by the pandemic. But they are not the main problem, actually. Next slide, please. The main problem is actually the shutdown of public transport, especially jeepneys and tricycles, and the checkpoints, and the fencing of potential sample respondents. That prevents the accessibility of respondents for surveying. We can't afford public transport for a nationwide survey because that would require going to at least 240 and maybe 300 barangays nationwide. And we don't have the private transportation for that. That's the main problem, actually. Well, secondly is the hazard posed to respondents, which could affect their willingness to participate. So that's potential. Thirdly, will be the hazard opposed to the health of the interviewers, which could affect their willingness to work in the field. But actually, I think disruptions 2 and 3 are copable, except we don't know that yet. Next, please. There are already health protocols, actually, that have been designed by the Marketing and Opinion Research Society of the Philippines, MORES, which is the industry association of the profession. This AMOS is Association of Market Operations, Market Research Operations Specialists. Those are associations of interviewers and encoders. There are already protocols to deal with COVID, but we're not able to try them out. Next, please. I would like to show you what's in the protocols for dealing with COVID. There are hygiene, of course, you know this, using the mask and so forth. How to brief in the field, how to recruit your interviewers, practices in the field, where to go, house to house, locating, and so forth. How to deal with immunocompromised segments, how to deal with health professionals in hospitals and health centers. The trouble is that we can't try this out because there's no transportation. That actually is, I think, shooting ourselves in the foot. This excessive lockdown is disrupting data gathering. And I think that that's the biggest problem now. We are anxious to go back to the field, and we think we can do it with those protocols. But we can't do it without jeepneys. Next, please. We have discussed the COVID with our interviewers, and there are some who are afraid to go to the field. But it's not extinguished. We think there will be enough interviewers who are willing to go into the field. We think, of course, that respondents will be less willing to be interviewed, but we think there will be still quite a few who would be willing, especially since we're going to show them that we're using protective devices and we're going to be offering them masks and so forth. But the best way to assess that is to do field testing of face-to-face. Now here's the problem again. We can't even field test face-to-face because of the policy lockdown on public transport. So this, to my mind, is the terrible thing about this is not the COVID itself. This is the government response to the COVID and locking down public transport, and that is affecting data gathering. This is the bad part of it. Next slide is. As I said, the real constraint is the lack of public transport. Now, luckily, until public transport is returned, there is a practical and feasible alternative to face-to-face survey, and that is the mobile phone survey. Next, please. We have been able to do 2 mobile phone surveys so far. These are national surveys. Early May, 4,000 respondents, and then early July, 1,500 respondents. Those are very adequate sample sizes. Our normal sample size with the face-to-face is 1,200. One should be skeptical of opt-in surveys. That's why I put them in quotation marks, because they're not really surveys. They're self-selected respondents. That's when institutions like NEDA, like even the World Bank, invite people to answer a questionnaire. Now, no matter how large the sample, 10,000, 20,000, 40,000, it doesn't matter. If it's not a probability sample, you can't compute the error margin. It's not a scientific survey. It just gives a feeling of, you might say, a little, it's like an aspirin. You think you can cope with it. But those are not surveys. Those are not surveys. Those are not the real one. Those are only quote unquote surveys, and they should be disregarded. Next, please. Now, the disadvantage of a mobile phone survey is that it's oral and it's easy to put down the phone and stop. So it only lasts about 20 minutes. Unlike a face-to-face survey, which normally goes for an hour, and therefore you can ask a lot more questions. So the quantity of data you can get with the mobile phone survey is much less, only 1/3 of what we can get with the face-to-face survey. Now that means researchers had to be very judicious in setting the survey agenda. There's no surplus time for asking, you might say, trivial items. We must be very, very careful and only get the data that's the most important data to get. Next, please. All right, so here's a very specific example. This is hunger. We've done 2 surveys of hunger, and in the first round, we had it coming up, total hunger to 15.8% as of last May, and then 20.9% as of last July. So this is a fantastic rise in hunger during the pandemic. And by the way, there is the history of hunger. You see that there is the hump. I call that the hump of hunger. That's from about, especially from about 2008 up to about 2014. You have a huge hump in hunger, which was luckily going down already in 2015, 16, 17, 18, and that's mainly because of the falling rate of inflation, especially in the cost of food. But that's turned around. Things are so very difficult now with the pandemic. But we wouldn't know this if we didn't do surveys. You see, we'd just be blank. Let me repeat, there's no government data on hunger. This SWS series here is the only quarterly series of hunger, I believe, in the whole world. And it's quarterly, and that's how we can get data on this rapidly. Just go to the website, it's always there. Right? This is one of our complaints, that the government doesn't use its resources appropriately, and its tracking of hunger is very, very slow. It's years, always years too late. Next, please. Okay, this is another example, and I don't want to spend all of my time on examples, but of course we had to ask what people think about the COVID itself, and here's the very great worry about being infected from COVID. People's worry about COVID is much worse than their worries in the past about Ebola, swine flu, bird flu, and SARS. Every time those infections came around, we asked them in our SWS surveys, and actually those worries, great deal or somewhat worried, those are actually very high compared to the worries of other peoples in the world, because we've been able to compare. So we already know that Filipinos are, by and large, more worried, more nervous people when it comes to illness like that. But this is the worst of all in all of these years since 2003. Next, please. This is pessimism and optimism. You see, we had a very large surplus of optimists over pessimists. That's the green line over the red line in the past several years. And suddenly, this is as of May, but we will report the July result very soon, maybe by next week. Suddenly, you have pessimism dominating over optimism. 19 points. There's never been such a dominance of pessimism over optimism. So this is This is one of the most common indicators in the whole world, and it's, well, it shows you the situation, right? This has to be, we have to continue monitoring this. Next, please. But we have to do many other things too, not just COVID. This is public opinion about the ABSCBN franchise. 3 out of 4 Filipinos say Congress should renew the ABS-CBN franchise. That was first week of July. That was just before they denied the franchise. Although we were only able to report that actually the day after they denied the franchise, because they denied it on July 11, I think, but we still needed a few days after the fieldwork in order to bring up the data, do the data processing, and to compute it. So you see the unpopularity of the cutting away of the franchise, and you also see 56% saying that non-renewal of the franchise is a blow to press freedom. Of course, we see that the administration has not been paying attention to public opinion, which, well, that's one of the frustrations of doing public opinion research, when you see that the administration does not pay attention. Next. This is another report. It has to do with China. And this was done because we knew very well that the anniversary of the decision of the World Court, well, the arbitral tribunal, the decision in favor of the Philippines, the case against China, that anniversary was on July 12. So this is very pertinent subject for the mobile phone survey. The first 2 items there have to do with China's relevance to COVID itself. And you see, these are all very negative feelings about China. 61% believe that China did not immediately share their information on COVID-19 to the world. And of those who said that, 77% agree that China should be held accountable for it. So this is very much of an anti-Chinese feeling. The lower 2 items there have to do with the West Philippine Sea. 70% agree that the government should assert its territorial rights to the West Philippine Sea. Even more, 82% agree that we should form alliances with other democratic countries that are ready to help defend our territorial rights in the West Philippine Sea. This is not the first time for us to find these results. These have been very consistent over the past 3 years, ever since we won the case in the arbitral tribunal. So this is just a maintenance of anti-China feeling among the Filipino people. China is the least trusted country in the whole world as far as Filipinos are concerned. We also made a release about that. Negative, very negative trust in China. So all of these things are important to keep on monitoring by surveys, not only about COVID itself, but whatever is the most relevant thing that's going on. Next, please. Now, here's the rub. How can this be done? This can only be done if you have a compilation of mobile phone numbers. That is a probability, that is probability based. Now this is Foresight. SWS had been compiling mobile phone numbers since 2017. from 2017 to 2019, when we had been doing our face-to-face probability surveys, we asked the respondents if they would permit us to re-interview them on their mobile phones. So they gave us their mobile phone numbers. And we were able to compile 31,000 mobile phone numbers from all over the country from these face-to-face surveys. We did this gradually, survey after survey, to prepare for times when we may want to survey by mobile phone mode. Right? So this is very fortuitous, right? Because there's really no easy source for mobile phone numbers. And the telcos are telling us that they're worried about the Privacy Act, and so they're resisting cooperating with providing mobile phone numbers. But luckily, we did it already, right? Next slide, please. So we know where these numbers are. They're from all over the country. Here they are. They're spread in all the regions. There are more in NCR, 7,000, because we do more surveys in NCR. And there are also more in the Bangsamoro Autonomous Region. And that's because we've been doing special surveys in Bangsamoro. On account of the issue in Bangsamoro, we've got quite a number of commissions to survey there. And so we had a lot of numbers from over there. And so we sample here now from each region, region by region. But of course, when we put them together, we only weight them in accordance to what is the population weight for that particular region. Not in accordance to how many numbers we got, but in accordance to their population weight from the census data. Next, please. So we got 4,000 in May, and we got 1,500 in July. Actually, May was a little bit too large. We overdid it, I think, but we were just worried that we might not get enough. So we kept on calling for a longer period. We called for 7 days. And actually, we were hoping to get 300 at least for Metro Manila, and we got 294, which is about right. In July, we got, when we got 1,500, then we got, as you see there, 300 in Metro Manila, 450 in the balance Luzon, and so forth. Those are very, very adequate. In our quarterly surveys, when we do 1,200, it's 300 in Metro Manila, 300 in the balance of Luzon, 300 in the Visayas, and 300 in Mindanao. You use these knowing that they are probability samples, and you just apply the proper error margin. That would be plus or minus 6% for the 4 areas, and plus or minus 3% for the nation as a whole. And then you analyze accordingly. You don't exaggerate. You know, if something is within the error margin, you don't call it significant. Right. Next, please. So, for both mobile phone surveys, when you get the data, we weight them using census weights, 13% for NCR, 45% for balance of Luzon, 19% for the Visayas, and 23% for Mindanao, because that's as it should be. We also weight by gender, 50% each, male and female. Right? That's to make sure that we get an even distribution by gender. Because if we just leave it up to what we got, well, as a matter of fact, we get 60% female respondents and only 40% male respondents. Women are more accommodating. So that's just something we learned. They're more accommodating, and we thank them for that. But just the same, when we put the data together, in every area, we make sure that there are half males and half females in weight. Okay, we use all the data, but we weight them equally. That's the way to go about it. Next, please. Now, unweighted. suppose we don't have the weight. We look at the ages and we look at their educational levels, and these are what we actually got without any weights, which is very, very reasonable. For the May survey, we have an age group there, 15 to 17, because at that time, we decided to take respondents from age 15 because age 15 is the legal working age, and we had questions that had to do with work. But as a matter of fact, we only got 1% responses from that age group of 15 to 17. Now, the distributions, as you would see, are very, very almost identical between May and July, even though these are not the same people. Huh? This is not the same respondents in May and July, but they came from the same compilation, all right? They came from the same compilation, so they have very similar characteristics for the two compilations. If you were to ask me, I would say maybe we have too few non-elementary graduates, a little bit, but not so much. And for college graduates, that's correct. Only about 17% college graduates. The bulk are really there just above high school. And by high school, we mean junior high school. We mean junior high school. The elementary graduates, there are finished elementary and maybe a little high school, but did not finish junior high school. Now, this educational distribution is our proxy for socioeconomic class. We cannot have socioeconomic class data because that in an ordinary face-to-face, that depends on a visual judgment of the home and the appliances in the home, and it's done by the field interviewers. But on a mobile phone, you can't see the home, so there's no socioeconomic classification of the same style. We use education instead. Another thing that we were not able to continue is the self-rated poverty, because the self-rated poverty requires a visual aid. It requires showing the respondents a card with two words, mahirap and hindi mahirap. That's, of course, that's a very, very simple visual aid, but we can't reproduce that when we're interviewing over the telephone. And so we have not been able to continue the self-rated poverty series in 2020 for the meantime. But we were able to continue the hunger because that's only done verbally, all right? That's done verbally. There are chats coming in, but I can't answer them right away. I'll try to answer them later on, okay? Next, please. Next slide, please. All right. Now, what's the problem in surveying my mobile phone? This most problem is actually the telecom barriers, all right? You can't be unable to reach the number, all right? Maybe they're not working, out of order, and you get these other messages. It's incorrect, out of coverage area, cannot reach them, cannot be completed as dialed, and so forth, right? So these may be temporary or they may be permanent. We don't know, right? Maybe they'll come back again. Maybe they were just off for a while. But to cope with these, we need replenishment, and we'll need some cooperation. We're trying to look for more numbers on a probability base. That's the big problem. And I hope that someday the telcos will cooperate with us. There are other problems which are not telecom problems. They are problems with the respondent side, like ringing but not answered. The number's always busy. Sometimes it's hung up. But these are just counterparts. In the face-to-face mode, these are only counterparts to dwellings which are unoccupied or unresponsive to the door knocking by house-to-house interviewers. You can't blame the respondents if they're not home, all right? You can come back later or call again later, but these are normal. Nobody home, that's normal. That's the same as in face-to-face surveys. You just have to put up with it. You just have to be patient. That's why you need to have a base from which to sample. Next. Now, outright refusals, when you actually get somebody on the telephone, you ask them if they would like to cooperate and then you get a refusal, those are actually few. And I think it's due to our good reputation and that people are willing, most people are willing to cooperate and answer the questions. Actually, in our face-to-face, we get lots of people who are so overjoyed that they have been sampled and that they are willing to share their opinions in a public opinion poll. If they know that it's a real McCoy opinion poll and it's not an attempt to sell them anything. Right? That's part of the ethics of opinion polling. You don't try to sell them anything. All right. If you do that, you're not an opinion pollster anymore. You're a marketer, right? And that's a different occupation already. Next, please. Right. Now, how do we test this? Right? Because in science, you need validation. This is what we insist on. We want everybody to try it also, independently, validate it. If you can do face-to-face, why not? But you'll be met by the transportation problem. If you have a telephone probability sample, go ahead and do that. In fact, the telcos should do it if they can. Why not? And that's the way whereby you can validate whether what we're doing is correct, and we challenge that actually. There should be more. There should be more. We're not saying, that we must be correct, but we try to do it properly, and this is what we get. And we're waiting for others to see if they can deny getting the same results if they do it the same way. And then last slide here. Now, and if you've done it well, don't forget to archive your survey data because you'll be needing this over and over again. If it's first-class data, then it should be archived. Right? That's what we encourage to everybody. In our data bank, we have already 1 million interviews in the past 35 years. And we go back to these again and again for more analysis. Maraming salamat.
Thank you, Dr. Mangahas. That was really, really interesting. And there are a few questions
Yes.
on the chat.
I'll look at them again.
And maybe I can summarize some. There's a few that point to, I guess, the methodology, which I think you spent a lot of time on, and that has to do with, the sampling. Thank you, Mon. Yeah. And how do you make sure the sampling is representative? I guess related to that would be the 31,000. Would that be enough?
Well, those were originally probability sample. So that's our justification for using them, and then visited face-to-face. Now, question framing, they are in our website. When we make our reports, we put the exact question there in Filipino, and you can look it up, right? The results shows that the government does not encourage. That's true. That's true. That's true. Yes, the 31,000 were randomly selected because they went through our original random selection face-to-face in those earlier years. Doctor, what is the probability of one Filipino being a respondent in his or her lifetime? I think we've asked that, and I think it's 5 to 10% probability of being surveyed at any time in your entire life? As I said, we've got 1 million interviews in our data bank in 35 years of surveying. Now, 1 million out of 100 million present. Well, not 100 million, because we don't interview children most of the time. It's not more like 55 to 60 million adults. Right?
So maybe something like 2%, I guess.
Yeah, something like that.
Yeah.
Oh,
So there's another question here from.
Any more questions?
There's a question, Dr. here from Edsel Peña, Dr. Peña, and he says, "Thank you, Dr. Mangahas. The pool of 30,000 plus mobile phone respondents may be a biased sample to begin with, since they are people with mobile phones. Is there a way to see
they are the
amount?
people that we surveyed originally, not with mobile phones, but mobile phones are now held by 85 to 90% of the people. Almost everybody has a mobile phone. So it's a very good way of sampling now. So we didn't select only people who had mobile phone. We selected from the people we had sampled in their homes, and then we asked them if we could re-interview them on their mobile phone.
Okay. Yeah. I think that clarifies. Yeah. One question from Christy Galliano. Are respondents paid?
No, they're never paid. Sometimes we are given enough budget in order to give them a little token, like a notebook, something like that. It's a kind of a thank you, but that's rare. That's done for big surveys where we've got them for an hour and a half to 2 hours. It's a kind of a little thank you, but there's definitely no money. There's at most a notebook, a face towel. Those are the only kinds of tokens that we give. We're not like the market research where they give free samples of consumer goods. No, that's a lot more. No, we don't do that. For them, it's really the pleasure of being civic-minded and contributing to the survey. And so we're very thankful, of course, to those who participate. Now, if they don't want to participate at all because they're too busy, well, we can't do anything about that. That's like in a democracy, If you choose not to vote, you're not required to vote, but then you will not be counted. See, what can you do about that? And you have to live with that.
Yeah. Well, let's thank Dr. Mangahas for his talk, and we'll have also more questions and more time after all the talks for our panelists. So please, for the audience, keep typing away in the chat, and keep asking your questions, and we'll have time to get to your questions.